morning, this is Rebecca. I am lecturer, Faculty of Physiotherapy, Dr.M.G.R. Educational and Research Institute. So today we are going to see about active movements. So active movements are the movements which can be done by the patient actively without any assistance. So gravity oda help vachi patient avangale vandu thannala pandra and exercises da active movements solvom. So basically the active movements are classified into free exercises, assisted exercises and resisted exercises. So we will see one by one exercises with a model. So now we will see the free exercises for all the joints. So free exercise abdina the patient can do this actively without any the assistance of the therapist or any other person. So first nama cervical joint paakalam. So cervical joint la we have the movements such as cervical flexion, cervical extension, cervical side flexion and cervical rotation. So these were the free exercises for the cervical joint. So we'll see about the free exercises for shoulder joint. Shoulder flexion, neutral, shoulder extension, neutral, shoulder abduction, neutral, shoulder internal rotation, neutral, shoulder lateral rotation, neutral, circumduction. So we'll see about the free exercises for elbow joint, elbow flexion and elbow extension. So now we'll see about the free exercises for radioulnar joint, pronation, neutral, supination. So next we'll see about the free exercises for wrist joint, wrist flexion, neutral, wrist extension, neutral, wrist ulnar deviation, neutral, wrist radial deviation, neutral. The free exercises for the finger movements are finger flexion, neutral, finger extension, neutral, thumb flexion, neutral, thumb extension, neutral, thumb abduction, neutral, thumb adduction, neutral, thumb apposition, neutral. So now we'll see about the free exercises for the lumbar joint. So lumbar flexion, neutral, lumbar extension, neutral, lumbar side flexion, neutral, lumbar rotation, neutral. Now we'll see about the free exercises for hip joint, hip flexion, neutral, hip extension, neutral, hip abduction, neutral, hip adduction, neutral, hip circumduction, neutral, hip internal rotation, neutral, hip external rotation, neutral. So now we'll see about the free exercises for knee joint, knee flexion, knee extension. So now we'll see about the free exercises for the toes, toe flexion, neutral, toe extension, neutral, toe abduction, toes adduction, So we have seen all the free exercises for all the joints in our body. So in the free exercises vandu or assistance oda with the help of the therapist, if you are doing means, that is called as assisted exercises. So idhe same free movements with the assistance of a therapist, because avangala full range panna mudiyadhu. So nama vandu avangalukku assist pandra mari help pannona, that is called as assisted movements.